start to the inspection, palpation, percussion, and auscultation of the different segments the body. Here, inspection and palpation of the skull, any deformity, asymmetry, injuries or sensitivity are evaluated. Examination of the scalp and hair. The quantity, distribution, texture, and possible anomalies of the hair are observed. Examination of the face. Symmetry, facial movements, presence of edema, jaundice, or lesions are evaluated. Eyes inspection. The symmetry, size, and position of the eyeballs is observed. Examination of the eyelids and conjunctiva. The color, inflammation, and presence of lesions are evaluated. Conjunctiva. Evaluate visual acuity. A essential chart used. A essential. Pupillary reflex. The response of the pupils to light, photomotor reflex is referred. Used. The retina, optic disc, blood vessels, and macula are evaluated. Retina. Ears inspection. The shape, the size, the symmetry of the ears is evaluated. Symmetry of the ears. Otoscopy. The external auditory canal and the tympanic membrane are inspected. Inspected canal auditory. Of the canal auditory. Nose and paranasal sinuses. Inspection and the shape and the deformity are observed. Deformity in the nose. Anterior rhinoscopy. Inspect the nasal passage and evaluate the mucosa, turbinate, and nasal septum. Observe mucosa in the nose. Palpation. The frontal and maxillary sinuses are evaluated. Detect the term or pain. Mouth and throat. Inspection and exploration of the pharynx. Inspection. The lips. Inspection the lips, teeth, gums, oral mucosa, tongue, palate, and uvula are observed. The pressure is used to evaluate on the tonsils, anterior and posterior pillars are on the posterior wall and the pharynx. Neck inspection and palpation. Mobility evaluation. inspection and palpation. Evaluation symmetry, presence of the masses, anteroid and trachea. Touch the neck. Mobility evaluation. Mobility evaluation asks the patient to perform neck movements, flexion, extension, rotation, and lateration. Thorax. Inspection, palpation, percussion, auscultation. Inspection. The shape of the thorax, symmetry, respiratory movement, and used accessory muscles are observed. Palpation. Palpation, thorax expression is evaluated. Percussion. The lung fields are evaluated on the detect resonance dullness. Auscultation. Listen to respiratory and hair sounds to detect within rushing, growls, hair murmurs, and abnormal rhythms. Use it as a stethoscope. Abdomen. Inspection, auscultation, palpation, percussion. Inspection. The shape, peristaltic movement, scars, and lesions are observed. Lesions observed in the abdomen. Auscultation. Listen to intestinal sounds and possible vascular murmurs. Percussion. The presence and the tympani is evaluated. Evaluated percussion. Palpation. The presence of the masses, tendinosis, hepatomegaly, splenomegaly, and painful rebound are evaluated. And lower extremities. Palpation, inspection, evaluation of the muscle mobility and strength. Reflexes. Inspection. Symmetry, coloration, edema, deformities and injuries are observed. Palpation. Temperature sensitive, peripheral, pulses radial, ventral, femoral, popliteal, posterior, tibial, and pedis. And presents the nodules and the muscles evaluated muscles. Evaluation of muscle mobility and strength. The patient is asked to perform active and passive movement and evaluate strength against resistance. Spin, inspection and palpation. Inspection. Alignment, natural curves, presence of the scoliosis, kyphosis, or lordosis, and sensitivity to palpation are evaluated. Evaluated the spin of the scarred scoliosis.